We are joined by Dr. Audrey Klenke from Pinnacle Plastic Surgery.
Hi.
Oh, hi, always so good to see you.
Thank you.
And we are talking about some non-surgical options today. There are many, many of them, and mostly it includes Botox and fillers. Those are the two different categories.
Botox and fillers are definitely among the most popular, and I think the reason is because they're so easy. They're quick. You come into the office, we can not only do a consultation, but usually I can do your injectables that day. They're very safe and they're very effective, so people love them.
Yeah. I mean, I know I'm a huge fan personally, not to disclose too much, but Botox, why do you think it's so popular among all ages?
You know, Botox is becoming more and more popular even amongst, our 50 and older crowd sometimes have a little hesitation, but as time goes on, Botox is used for so many things. It's used in babies, it's used in bladder dysfunction, neck dysfunction, migraines, all sorts of things. So the beauty of it is that it can also be used for wrinkles. So anywhere you have a wrinkle that is causing a line, you can make that go away.
Yes, I'm smiling because Dr. Audrey Klenke fixed my frown scowl line. I mean, it was bad.
We just relaxed it.
Well, it would scare small children. I mean, it was bad. And look, I'm scowling. I'm scowling now.
But you're not.
I know, it's fabulous.
It's a beautiful thing. It's a beautiful thing. And it's a great option even for people who have like some of the bands in their neck. And we're starting to really use it a lot around the mouth. So people who have that really tight purse and they just can't help it, it's part of their natural expression, or they smoked years ago or whatever. The up and down lines, Botox can really help those quite a bit.
Wow.
Yeah, it makes a big difference.
Well, let's talk a little bit about Botox.
Sure.
Like, what is it
What is
and
it?
how does it work?
Yeah, so there's sort of like the curiosity factor there. So Botox is a purified form of botulinum. So it has been broken down to its purest form. It is incredibly safe, and it's been used for so long in such high volumes that it's actually the most studied medicine in the world. In fact, there was a paper that came out recently about it being safer than Tylenol.
Wow.
And we've all seen some things recently in the literature about anti-inflammatories and some of the spooky things there. Botox is just a very safe medicine. So it's a muscle relaxer. So it actually encourages your muscle to just sort of relax. It does wear off, so it wears off after about 3 months. But what you'll notice is if you keep up with it, especially that first year that you're using it, your brain actually starts to train itself to know, I don't have to make that face anymore. So a lot of people can get away with going a little longer or don't need quite as much. So you kind of, it's like you're training yourself.
I started mine at 29 and I'm now 30. No, I'm kidding.
You could have fooled me.
And, you know, at 40 now, it absolutely does. I could go like 6 months.
Oh yeah.
After I just was pretty religious about doing
regular. And the fillers are a little bit different. So the fillers are more of a volumizer.
All right, you talk about those.
The Botox won't add any volume. It's just a relaxer, whereas the fillers are adding volume where we've lost it, and we all lose it in our faces.
What do you mean by volume? Like, what it?
So you're replacing, most of the fillers these days are hyaluronic acids, which is a substance that we have naturally in our body. It's very common in our joints, but we do have it everywhere in our bodies. We lose it over time. So we start to get drier and we start to lose actual volume. We look thinner in our face.
Okay.
So the fillers can go anywhere, really. They can go in your cheeks, they can go in the lines by your nose, they can go in your lips, around your eyes, temples. They can really go all sorts of places. It's just about meeting with a plastic surgeon and talking about what is the safest filler for me, what should I be using in what area, because you really have to find the right product for you.
You do have to find the right product and the right person. I mean, it all really boils down to consultation.
Yeah, so it's really about talking with someone and learning, okay, what exactly are we going for here? Are we going for subtle? And the fillers are such a nice option because you can see what's happening as you go along. So a lot of times we'll inject a little bit and then we'll pause and I'll have my patient look in the mirror and they'll say, I like that, let's do a little more. So I can kind of get a feel for what we're doing as we're doing it.
Now I can actually speak to the consultation with Dr. Klenke because we talked about fillers. It's something that I'm definitely interested in. And the beauty of having a consultation, in my opinion, is that it's in my head now. I have information on it. We sat down, I talked to her, I feel very comfortable with her, and now it's a matter of when I'm going to do it, but it's filed in my to-do.
Right. And oftentimes, I'll chat with people about ways to decrease your downtime. Like with the fillers, sometimes you can have a little bruising. We have a lot of patients that are taking aspirin and Motrin and fish oil and a lot of things that, or I've got a wedding in 2 days. or I'm flying to Europe in 2 days. And so we'll kind of have a chat about, okay, well, if we don't do it today, that's fine, but let's find the right time for you to try to maximize your results and try to limit your downtime.
And talk a little bit, how much downtime do you think there is with, it depends person to person, right?
Very person to person, but even with the fillers, if you have a little bruising, a lot of times you can cover it up with makeup, and there's no activity that you can't do. With Botox, for about 4 hours after your injections, you don't want to do a lot of really strenuous stuff. Like I wouldn't tell people to go straight to the gym, and you kind of want to be more upright, but that's a pretty short amount of time, so the downtime's pretty minimal.
Yeah. Now, let's talk about lips for a minute.
Sure.
There can get some lines that bleed with lipstick. Yes. Tell us how you fix that.
Drives you crazy.
Yeah.
So the up and down lines around the mouth, again, I think Botox is becoming a better option because you're treating the problem. The problem is the circular muscle that goes all the way around your mouth and does that, purses your lips down. So Botox really treats the problem, but sometimes people want a little volume too. So you can put certain types of fillers in the pink part of the lip to give a little more plump. You can put it around the outside of the lip too to try to create that line to be a little more distinct and less bleeding with the lipstick. People love that. And sometimes even the lines that are further down beyond the lips can kind of, again, create the aging look around the mouth.
Right.
There are things like lasers as well that we often talk about, and peels. Peels can help a lot, but even your daily topical skincare can make a big difference. It's doing a little bit each day towards the ultimate goal can make a big difference.
Yeah, absolutely. Now back to one of my favorite things, Botox. You all, I understand there are Botox parties.
Oh yeah.
Okay, I need to get on this list to have one. Tell us a little bit about how one goes about doing this and what you receive.
Yeah, Botox parties are fun. They're really fun. So they're usually after hours. They're in our office. So we provide the location and I'm there. So I do all of our injectables in our office. But a Botox party is where you get a group of friends, a group of people together. There's always a host or sort of the ringleader. And the host does receive their services complimentary. And everybody gets exclusive pricing. So everybody's getting discounted pricing on their injectables. So we'll do Botox at these parties. We'll do fillers too. Fillers are fun. And actually we also do hydrofacials, which are a no downtime exfoliating type procedure that's also very hydrating, that's done by our licensed medical esthetician.
Oh, perfect.
So yeah, it's a really fun time. It gives you a chance to sort of scope us out, get some services at discounted rates, and have fun with your friends. Yeah, you get to just have fun. We love it.
In speaking of Botox, you all have a July special. Tell us about it.
We do. July is Wipe Out Wrinkles. So you can imagine someone on their surfboard.
Yeah.
But wiping out wrinkles, you can do, if you purchase 20 units of Botox, you get 10 free. So that 30 units of Botox covers quite a bit of an area.
Yeah.
Or you can do 2 syringes of our fillers, either Juvederm or Voluma, and you get 20 units of Botox free. So that's kind of fun. You get to kind of try a little bit of each.
And here's something exciting. I know there are a lot of folks very involved in the dragon boat races.
Oh, yeah.
And you all took part in that.
We did, yep. The first year was last year in 2014, and we're planning on doing it every year. We had the best time. So you get in these giant 20-person boats and you race. It's all for a good cause. You're raising money for cancer patients in the Beaufort County. So all the money stays here. Just a great time. It's at the Water Festival in Beaufort. So there's food and there's prizes and you're watching everybody race and it's just fun. We had a great time.
Perfect. And it's actually good for rehabbing.
It is, actually. It's great for your upper body strength. So we have a lot of breast cancer survivors and a lot of them come out and paddle. So yeah, they're getting sort of their arms back into the swing and it's fun to watch. It's really neat.
And it's a great way for folks to get to know you as well.
Yeah. Come on out and chat with us.
I know a lot of folks in Sun City participate in the dragon boat races.
They are fierce competitors.
Indeed. You don't want to waste any time getting a consultation with Dr. Audrey Klenke at Pinnacle Plastic Surgery. Tell us how you can get in touch.
Sure. You can always call us. We're at 843-815-6699. You can stop in our office anytime. We're open 8 to 5 Monday through Friday. You can just pop in, say hi. We have people do it all the time. Or you can look online. We're at pinnacleplasticsurgerymd.com.
Perfect. Make sure you get your consultation. Don't waste any time.